Hi, in this video we'll talk about another surgical treatment for male stress urinary incontinence after prostate surgery, namely the artificial urinary sphincter. The artificial urinary sphincter is usually offered for patients with moderate to severe urinary incontinence after prostate surgery. It is an old treatment, has been around since 1972, where it was first introduced by Scott and Bradley. The initial device was a bit cumbersome and has many parts. However, over the years, several modifications have been introduced to the artificial sphincter, which was culminated into the introduction of the AMS 800 in the early 80s. And this is the device that has still been used until this day and is considered the gold standard for the treatment of male urinary incontinence after prostate surgery. Most patients have a degree of sphincter weakness or external urethral sphincter weakness after prostate surgery, and what the artificial urinary sphincter does is trying to compensate for the weak sphincter muscle by applying pressure on the urethra and stopping the flow of urine or the leak of urine. So the artificial urinary sphincter is a mechanical device that has three parts, namely the cuff, the pump, and the balloon. The cuff is implanted around the bulbar urethra. It is a fluid-filled cuff which is inflated all the time. It is connected to two things. The balloon is a pressure-regulating reservoir that is implanted into the groin area, and the pump which is implanted inside the scrotum. So the way the device works is when the patients want to empty the bladder, the patients press on the pump, and what that does is shifting the fluid from the cuff to the balloon or to the reservoir, and that deflates the cuff, so urine passes through, and then automatically after 2 minutes the fluid goes back from the reservoir to the cuff, so the cuff is inflated again, and in that time most patients have enough time to empty their bladder. The operation takes about an hour to an hour and a half. It's usually done under general anesthetic, so patients are put to sleep. Hospital stay usually is between 1 to 2 nights. Patients usually have a catheter overnight. This will be removed the next day. The artificial sphincter is not activated straight away after the operation. There is an activation button that is in the pump. So patients go home and they are expected to leak as before the operation. And then the activation of the device happens 6 weeks after the operation to allow time for the sphincter to heal. And that usually is done in the outpatient clinic where one of the advanced nurse practitioners activate the device, and that's where patients find out the results of the surgery. So patients have two cuts, one in the perineal area between the scrotum and the back passage, and another cut in the groin area. The perineal cut or incision is to implant the cuff around the bulbar urethra, and the groin incision is to implant both the pump and the balloon. So in the next video we'll talk about the success rate of the artificial urinary sphincter, the complication rates, and the patient satisfaction rates.